It's a problem infecting communities in every corner of the United States, including right here in the tri-state. The opioid crisis affects men and women of all ages, races, and backgrounds. Addiction does not discriminate. Hello, I'm Kayla Moody. In Vanderburgh County alone, 82 people died from overdoses in 2017. A number first responders say would have been much higher had it not been for the hundreds of doses of Narcan and naloxone administered by our local police officers, firefighters, and EMTs. Those numbers just one of the factors suggesting the opioid crisis is far from over. Indiana lawmakers are making strides. Earlier this year alone, Governor Eric Holcomb passed legislation increasing the number of treatment facilities in the Hoosier state and toughening the law to keep some of the worst convicted drug dealers in prison longer. The governor also signed off on legislation requiring more health professionals to look into their patients' prescription history before ever prescribing opioids. And another measure requires coroners to gather more information about suspected overdoses to be reported to the state. But most legislators agree there is still work to be done. Southwestern Indiana leaders were part of a statewide summit on opioid addiction that took place earlier this summer in Indianapolis. The summit was hosted by the Indiana Supreme Court. They brought medical professionals, law enforcement officials, and state leaders together to discuss ways to combat the crisis affecting thousands of Hoosiers. Officials from all 92 counties learned about the science of addiction, as well as ways to offer tools and treatment resources right here in our area. 44 News reporter Megan DeVinti was there.
The state is proposing a connection between medical professionals and the judicial branch, and I'm here with Dr. Jennifer Walthall about where this connection begins. Now, could you start by telling me about where the discussion begins between these two different communities?
Well, it turns out when you think about people first, instead of where they intersect with different systems, the conversation has to occur around who we're trying to help. And with addictions, substance use disorder, opiate use disorder, an intersection with criminal justice happens to be, unfortunately, all too common as part of that process of entering recovery. So to have a no wrong door approach wherever you enter, whether it's when you see your doctor, if you are in the emergency department after an overdose, or if you're standing in front of a judge being evaluated for criminal behavior or illegal activity, that entry into treatment and recovery has to be universal, and it has to catch you wherever you are. So what we're trying to build here in Indiana is a conversation that isn't about us versus them, it's about we. And we are healthcare, we are social services, we are insurance, we are mental health providers, and we are the criminal justice system. We all have to work together. No one has the right answer, no one has a silver bullet, but collectively, we get the job done.
And now, as a medical professional, what is the state of Indiana doing to help people in these small communities, in these counties, in these small towns to help with this epidemic?
We could talk for the next year about all of the efforts that have been ongoing for over 5 years to really catch up to a place where we found ourselves behind. I'll tell you, we had all the signs that this was coming, and we didn't have an infrastructure that was ready for it. We're taking a multidisciplinary approach to making sure that every community, whether rural, urban, or suburban, has all of the elements that they need to get folks into the treatment that they need and support them into recovery, whether it's prevention, whether it's reversal of overdose with naloxone availability, what we're talking about today, which is medication-assisted treatment, therapy. And so we're building that infrastructure to meet people's needs where they are.
And my last question is, what should people know about this? What is important for the viewers to know about this today, pretty much?
So we have a stigma reduction campaign that really promotes the 3 things that we need to know about opiate use disorder. One is that substance use disorder and opiate use disorder are a disease process. Once we start with that statement, we start to look at it a little bit differently than if it's a moral failing. So that's number 1, that opiate use disorder is a disease. Number 2 is that there's treatment. Like other diseases, treating addiction is important. And then 3, and I think the most important one, is that recovery is possible. When we have that hope that with acknowledging disease process, integrating treatment into our approaches to this as a community, that recovery is on the horizon. It's not something that we'll never achieve. It's right there for our families, for the people that we love.
Thank you so much. I appreciate it so much again.
Yes, thank you.
Reporting from Indianapolis, Megan DeVenti, 44 News.
Members of law enforcement are on the front lines of the opioid crisis, not only working to get narcotics off the street, but also responding to overdose calls in record numbers. I'm joined by Vanderburgh County Sheriff Dave Wedding. 5 years ago, most people had never heard of Narcan or naloxone, but in just the last few years, even 5 years, almost every Indiana law enforcement officer has been equipped with the overdose reversal medication. With that in mind, how has the opioid epidemic changed, the job for if you're not only your deputies, but also your corrections officers?
Well, it's brought a significant increase in the dangerous substances that we surround ourselves with. It's amazing now that our narcotics officers and deputies have to carry Narcan to possibly revive themselves if they were subjected to a carfentanil or fentanyl-based drug, even the residue that might be airborne while they're at a drug dealer's house or searching a car. Even in jails, that they've had instances where fentanyl had gotten in an air duct and caused many staff members and inmates to get sick. So it's changed the way we do things and certainly has brought a lot more danger to the workforce.
And how often are we seeing these overdose calls and responding and having to use Narcan here in Vanderburgh County?
Well, I was speaking with the fire chief this morning, Mike Connolly, and he told me that the Evansville Fire Department administers 20 to 30 doses of Narcan each month. So that's pretty staggering numbers. And I have spoken to individuals from the Evansville Fire Department, and they said it's not uncommon to go out multiple occasions on the same offenders using these drugs and knowing that they're going to have a chance to be revived. And they've almost started playing games with this revival. They have a game called Lazarus, where they think they're coming back from the dead. And they also have one called 9 Lives, where they challenge each other to see who can overdose and then be revived the most times. So when you start talking about that's crazy behavior and just puts everybody at risk.
And now it's not just prescription opioids that are being abused, but heroin has become more prevalent in recent years, but including the potentially deadly enhancements such as fentanyl, carfentanil. How has this, changed the game, so to speak, for your detectives who are actively trying to get these drugs off the streets?
Yeah, well, it's been very frustrating because now you have a drug that, is essentially an elephant tranquilizer. And just one, almost like a grain of, almost like a salt grain or sugar grain can cause serious injury or death to the subject that's ingested it. So it's changed the game, and people know that these drugs can be laced and still are taking the risk of ingesting it for the purpose of getting high.
And lastly, are jails adequately equipped, to handle people who are battling addiction? And if not, what would be the better solution?
Yeah, most jails in the state of Indiana are not built to treat chemically addicted individuals. I mean, the purpose of a jail years ago was for pretrial detainees waiting for court to dispose of a case. Now we have chemically addicted individuals in our jails, and we need treatment for them. And you almost have to pull them outside of normal housing and get them in special units that would deal with jail chemical addiction. So there are programs available, but there hasn't been funding earmarked yet for Vanderburgh County, because I would like to start a jail chemical addiction program where we bring people in and enroll them and work intensely trying to lessen their addiction to the drug, and then follow them outside of incarceration. So maybe put a case manager with them. So if you give them about 180 days worth of intense chemical addiction therapy, and then follow them afterwards.
All right, Sheriff Dave Wedding, thank you so much for being a part of this conversation. And Sheriff Wedding was recently named the 2019 president of the Indiana Sheriff's Association. Now, we will have more online talking about what he expects to do on a legislative level when it comes to addressing the opioid crisis.
Over the last several years, it is, really becoming an epidemic.
It's a growing problem. Babies born addicted. Coming up, what doctors are doing to treat some of the youngest members of our society and their mothers. Opioids have many names: hydrocodone, oxycodone, fentanyl. Those drugs are available by prescription only and used to relieve pain. And for many people, they're the only thing that works. 236 million of these prescriptions are written each year, and now doctors are trying to battle a growing problem. Expectant mothers legally prescribed to strong pain medications and what happens if they take them during pregnancy.
Every year, doctors and nurses at the Deaconess Women's Hospital welcome thousands of babies into the world. It can be one of the most amazing moments in a parent's life, but for some babies, the beginning of their life can be a challenge.
We do a little over 3,000 deliveries here, say, a year, and so last year we had 31 cases of infants with what we call Neonatal Abstinence syndrome. We call it NAS.
From the outside, they look perfectly healthy. Inside, some babies are fighting through terrible symptoms.
The bottom line is these kids usually will come out as far as, normal development, normal anatomy, and the problem is I see is that because mom is on that medicine, correct, and the baby is being exposed to that medicine, so the child is getting it on a regular basis via mom, and so when the baby's now born, is when I see the effects.
More and more doctors are coming face to face with a growing problem. Expectant moms taking opioids.
Over the last several years, it is really becoming an epidemic. Part of that has been driven by physician prescribing habits. More and more, we're seeing patients come in with a dependence upon prescription medications, and that really has added to the problem.
These medications can cause things such as premature birth, low birth weight, even birth defects. But most commonly, these babies are born with what's called Neonatal Abstinence syndrome, or NAS, where the baby goes into withdrawals right after they're born.
Some studies suggest that up to 60 to 70% of patients that are exposed to opioids in utero will experience some level of neonatal abstinence syndrome.
So you'll see as a baby starts showing many types of signs and symptoms. So they'll become very fussy. They're very agitated. They're very hard to console. They can yawn. They can sneeze. They have stuffiness.
Those symptoms typically show up about 2 to 3 days after birth. In about 2% of NAS cases, babies can experience seizures. Oftentimes, the misconception is that these babies are born to drug addicts. Sometimes that's true, in cases of the mom using drugs like heroin, but many of these expectant moms are actually legally prescribed these medications and taking them in the correct way.
It doesn't have to be opioids, but it's benzodiazepines and other type of meds that are addictive. And it's interesting because a lot of them are probably pharmaceutical type prescriptions that cause this.
Doctors have seen a 123% increase in these types of cases in just the past decade. In 2009, 13,600 babies were born with NAS. In 2014, more than 30,000 babies were born addicted. As more of these cases happen, doctors are trying to find better ways and better methods to treat mom and baby.
What we do for patients and I think it's important for folks to understand that the care of a patient with a substance use disorder needs to be multidisciplinary. It's not just reliant upon a maternal fetal medicine specialist. It's not just reliant upon an addiction specialist. It is everybody sort of needs to work together.
I know how to treat a baby, but the goal is how can we treat mom and help her so that the next pregnancy isn't the same thing over again.
There are several approved medications for treating babies with NAS. Doctors and nurses say physical interactions like cuddling or swaddling also play an important role in helping babies who are born addicted. We'll be right back. Welcome back. When someone is battling addiction, they can feel helpless and isolated, but there is help. Camille Stick joins us from Brentwood Springs, one of the facilities in our area offering support and treatment. This affects so many people from all different walks of lives. But one question I have to ask, should addiction be treated as a crime or as a disease?
Well, Kayla, I think that's a wonderful question, and I'm so glad you asked that because I think that while an addiction may lead someone to criminal behavior, the addiction itself deserves compassion and understanding, and that behavior, the behavior of the addiction itself, is not a crime. You mentioned in your introduction that this is affecting people from all walks of life. So at Brentwood Springs, we opened almost 9 years ago as an addiction treatment facility originally. We have since added mental health treatment as well, because those two are very closely linked. But I can tell you that we see people of every age, of every walk of life, and this is not people need to understand that this is a living hell to be in, this situation. So this isn't something that people are choosing as a course of life. We are finding that people are experiencing trauma that might lead them to this. They may have just had a hip replacement and been on some pain medications and everything in between. So this is a situation that first begs for compassion and understanding. And if you have not known someone or have not been associated with someone who is in this situation, you may have a lack of understanding about what's at the core of this.
What resources are available locally for folks who are battling addiction?
I think the Evansville community is responding in a big way. We are trying to fight the fight. As a state, Indiana is not faring so well, and so locally we just need more resources. We have a lot of people who are reaching out, trying to address this daily. We have a substance abuse council here. Crystal Sisson is the director there. She's doing tremendous work, and we have a lot of treatment centers here, but we're having a hard time connecting people to treatment, and also insurance is prohibitive. You know, they're not looking at this as a long-term problem. They're trying to offer short-term treatment for long-term problems. So we've got a breakdown in that as well. But there are lots of local resources here for people. If they want help, they just need to reach out for help, and including family members. Maybe the person suffering from the addiction isn't ready to reach out yet, but the family members can find support here.
All right, well, Camille, thank you so much for joining our conversation. We'll be right back.
The judicial branch is considering different ways of addressing addiction. I'm here with Judge William Nelson, who is here to talk with us about the topic. You mentioned earlier about the 911 call, and I'm so sorry to hear about that. And you mentioned this fixed mindset that you had prior to that and what you think now. Could you talk a little bit about that?
The fixed mindset was that I, like probably most judicial officers, especially in the criminal courts, used to treat or used to consider drug addiction as a crime. And I think many of the judicial officers across the state or across the country probably still do. But it took my wife making that 911 call after she discovered our son with a fatal overdose to change my mindset. And I'm part of the reason for the summit, probably the main part of it, is to educate other judicial officers to change their mindset and treat drug addictions or those suffering from substance use disorders as a medical issue instead of a criminal issue.
And so, as a judge in Indiana, you know, you're making these changes that could impact all these people. What is Indiana doing right now to help make a change or to kind of jumpstart a change for the future?
Today's summit is a huge jumpstart. I think it's the first time that not only do we have representatives from the court or the judicial system here, but we've got justice professionals from all over the state, including law enforcement, including treatment providers, probation, community corrections, all kinds of justice professionals to educate them on medication-assisted treatment primarily, because it seems to be proven through evidence-based practices that medication-assisted treatment, in addition to inpatient or outpatient treatment, works. Addiction is a disease that is treatable, and this is one way to do it. And this is the statewide summit, getting everybody together. We have to work together and collaboratively to make it work, and this is the first start.
And you touched on this a little bit earlier, and this is my last question as well. You mentioned also this morning crime versus addiction. Could you explain that? And you said we need to get over that barrier.
It's a huge barrier, not only for judges, but probably primarily for judges. Like I said, we need to not treat drug addiction criminally, we need to treat it medically. 10 years ago, as I stated this morning after the 911 call, if you were a drug addict and you had a case in my court, I treated you like a criminal. my mindset then was you were a junkie, you know, you chose to take that pill or stick the needle in your arm, but I don't feel that way anymore. So let's treat it medically instead of criminally.
Reporting from Indianapolis, Megan DeVenti, 44 News.
The opioid crisis certainly didn't happen overnight, and while the battle to overcome it seems daunting, we are making progress. We hope your family found this program educational, and those struggling with addiction will reach out for help. We'll continue to follow this important story. For 44 News, I'm Kayla Moody. Thanks for watching.